Recognizing the signs and symptoms of acute airway obstruction is crucial for prompt intervention and potentially life-saving measures. Here are the key signs and symptoms to be aware of. 1. Stridor. This is a high-pitched crowing sound that occurs during inspiration and indicates partial obstruction of the upper airway, often in the larynx or trachea. 2. Labored breathing. The individual may exhibit rapid, shallow breathing or use accessory muscles to breathe due to increased effort to draw air into the lungs. 3. Inspiratory retractions. Visible retractions or sinking in of the tissues around the ribs, sternum, or neck during inhalation, indicating increased effort to breathe against an obstruction. 4. Wheezing. Wheezing may occur due to partial obstruction of the lower airways, such as in the bronchi or bronchioles, and is characterized by a high-pitched whistling sound during expiration. 5. Cyanosis, bluish discoloration of the skin, lips, or nail beds due to insufficient oxygenation, indicating severe respiratory distress and impending respiratory failure. 6. Inability to speak or cry. In cases of severe airway obstruction, the individual may be unable to produce sounds or speak due to the obstruction of the vocal cords or larynx. 7. Agitation or anxiety. The person may exhibit signs of distress, restlessness, or panic due to the sensation of being unable to breathe properly. 8. Gurgling sounds. In cases of significant airway obstruction with secretions or foreign bodies present, there may be audible gurgling sounds as air attempts to pass through the obstruction. 9. Decreased level of consciousness. As oxygen levels drop, the person may become confused, disoriented, or lose consciousness, indicating severe hypoxia and impending respiratory failure. 10. Sudden onset of symptoms. Acute airway obstruction can occur suddenly, especially in cases of foreign body aspiration, anaphylaxis, or trauma, leading to rapid deterioration of respiratory function. In conclusion, it's important to note that the signs and symptoms of acute airway obstruction can vary depending on the location and severity of the obstruction. Early recognition and intervention are essential to prevent respiratory arrest and potentially fatal outcomes. Immediate action, including clearing the airway, performing the Heimlich maneuver for choking, administering oxygen, and summoning emergency medical assistance, are critical steps in managing acute airway obstruction. Thanks for watching. This is your Ayaman medic, signing off.